My name's Andrew Romanoff. I'm running for the U.S. Senate. I used to be the Speaker of the House in Colorado and the President of Mental Health Colorado. This is not our first virtual town hall meeting, and I suspect it won't be our last. So I hope that you and your family, wherever you are staying safe and healthy. I really appreciate you joining us. We're here to talk a little bit about the impact on mental health of the coronavirus pandemic. It's one of the consequences of this crisis that hasn't gotten as much attention, and we'd like to help folks understand how to address their own mental well-being and care for their families at the same time. Dr. Hunter Kennedy is the Executive Director of Footprints to Recovery, and I really appreciate your willingness to join us on short order too. Thank you, Dr. Kennedy.
It's my pleasure. Thanks for having me.
Can I ask you, Hunter, about the population you serve, folks who face substance use disorders and what they are doing or can do to keep themselves safe and sober? So I was just asking earlier, with respect to the population that faces a substance use disorder and or a mental health disorder, are there things that people can do or have you found effective to do in keeping themselves safe and sober?
Well, very much so. I mean, it's a very known fact that isolation is one of the proponents for usage and addiction. And what we practice here is body, mind, and spirit. And so I think it's important for everybody, not just people who are suffering with addiction, but to keep yourself physically active, keep your body moving, to keep your mind active and off of fear and the what if scenarios. And I think it's important for whatever your spiritual practice is, that you engage in it and that you use this time and situation to actually prepare a plan for yourself and to create physical activity, to create mental activity and some kind of, spiritual or other connectedness practices. And so we're seeing a lot of people now going into online meetings, going into telemeetings and using telephony. And so I think it's important that people in the community of sobriety and other networks stay connected and keep moving forward with what they're doing.
Some folks are talking more about kids. I heard a comment here about a 17-year-old son who's not taking this crisis seriously. Other concerns about kids who are living on their own but are facing the stress that comes from job insecurity and high rent. Any thoughts to address either end of that 20-something boundary for many of our panelists?
Well, I'll start just because I happen to have a couple of 20-something daughters, and their mentality is, this isn't really a fear or an impact for the younger generation. And I think what we're going to find is, even today, I think I read that they're finding impact on teens and younger people as well. And I think it's important just to understand and educate that, something like this is of huge national concern and it's going to impact them just as well. And so to be mindful, to be safe, to learn from this, to, practice these initiatives and behaviors on their own is ultimately going to be, life's worth of education coming full circle, I think.
I want to pick up, thank you. I want to pick up another question, and I'll read this in its entirety. The LGBTQ plus community experiences a disproportionate burden when it comes to behavioral health outcomes. Coming together as a community in safe places helps decrease the sense of marginalization. How can we help individuals maintain community virtually?
And I'd like to chime in just a little bit on that because I think social responsibility is something that all of us need to focus on and adhere to during a time like this. And I think that members of certain groups that have concerns that are affecting their group should be, step up and, start a peer group or start a phone call-in group. And start maybe a Facebook group or something just to help connect people that are in the same situation and feeling the same way they are.
I want to just add a personal question. I'm really worried about my mom and my dad. My dad will turn 80 this month. I'm not sure my mom wants me to broadcast her age across the internet, but she's not far behind. My dad's in Ohio. My mom's in California. I'm here in Colorado. And I'm worried about them. What can you tell me? What can I tell them? How do you address? I know we've been talking a little bit earlier about what to tell your kids, but I'm a kid of two parents who are in this risk group. What can you tell me?
My own mother, I had a conversation with her yesterday, and like most people are probably doing, this is what we're talking about because it's what's in the news and it's what's here. And so after talking about it for a few moments, the conversation is, are you doing what you need to do? Are you being safe? And then shifted gears completely to talking about the old times and old days and remember when. I think it's important for us to sometimes just get away from, just talk about the fun, the family, the friends, other situations. I think can relieve us a little bit of the tension and continuously talking about the problem and what's in front of us. If we're doing what we need to be doing, that's really what we can do. And moving forward and trying to keep as light of heart and give yourself a little bit of space to breathe and laugh, I think is important.
I want to come back to a couple points you all are making. One about kids, but particularly the point that Bev made at the end around the value of structure and routine. One of the ways that we measure mental health or mental health conditions is the extent to which some of these disorders interrupt our daily routine and interfere with our ability to conduct the regular activities of ordinary life. But obviously those activities have been interrupted by necessity here. And one of our viewers is asking, she says she struggles with anxiety and depression. Gym and church and community were her lifelines. Those have all now been taken away. So she's asking for suggestions in that context. Any thoughts from our panelists about that?
Well, I'd like to start on that just because this is something that we're experiencing, huge in the recovery community, because people that are in recovery rely on meetings and social networks and gatherings. And the thing is, I think we have to recognize this is a temporary situation. It's not a permanent situation. And I think it's important to modify, using the phone, using FaceTime, using other means to stay in touch and stay connected to church friends, church groups, or other groups and activities. So you keep that connection and you keep your mind in that, knowing that this too shall pass. It's one of those things that we're changing and modifying for a season, not for permanent. And so understanding and recognizing that, hey, I just need to do this for now, and then things will return to normal at some point in the future.
I'm asked to repeat, and I will keep doing this throughout our conversation. The crisis line, 844-493-8255, 844-493-8255, or you can text the word TALK to the number 38255. I'm not on commission for Rocky Mountain Crisis Partners. I just want to do my part to make that number as widely available as possible. And I don't know, Bev or Carrie or others, if you've gotten this kind of question, but Tom was talking a little bit about his place in the mountains, and it feels like we all are getting cabin fever. So one of our viewers wants to know, in those circumstances, are there ways to combat cabin fever from self-quarantine, and should we stick to a schedule?
And I'd like to chime in on that too, Carrie. That's a good point, but that was kind of what I alluded to earlier, that you need to have a plan. And so I am personally making a list of things that I want to get done at home. I mean, painting a room and doing some other things, writing, that I've left behind that I haven't done. And so I think each individual needs to actually make a plan of things and activities like that, to avert the cabin fever. If you're being productive, everybody knows existentially meaning and purpose is what we're all about. And if we have a list of things that we want to accomplish or want to do, we're going to be a lot more successful at navigating this period without falling into the what if and the depression, if we're keeping busy and we're setting goals and accomplishing things during this time period.
And again, if we're asking questions that our panelists can answer, we'll try to post these in part of an online conversation that will keep going on Facebook and Twitter at Romanoff 2020. We were talking a little bit earlier about kids, and I know, Carrie, you've got a 2-year-old. Do you all want to talk about age-appropriate conversations during this pandemic to have with kids? It's a conversation that we've had a lot over the last year when it came to the climate emergency, because there's a great deal of understandable and justifiable anxiety that is set in, especially among younger Americans who recognize the damage and the danger that crisis presents. What can we do, and how do we make sure that the guidance we're offering our kids is age appropriate?
Well, and I'll start just because I think it's very important that we live in an information technology age. And so kids are getting information. I mean, I'm always amazed. My niece, when she comes up to me, I'm like, where did you get this? And sharing amongst friends, they're texting, they're on the internet, they're on all sources. They make up their own stories and they present it as fact to others. And so I think being straightforward and informative and actually asking, what do you know? What do you believe about this? And then helping to make sure that their thought process is in a healthy, productive way, because we want to be responsible. We don't want to be fearful. We want to, create dialogue that answers questions and stimulates action, not inhibits and creates, fear. And so I think in with them and seeing what their thoughts and feelings are around the situation is a great place to start. I'm real big at giving my children tasks, those small tasks. Hey, you know what? We're going to paint. Your job is to do this. And that takes their mind and their emotion off of fear and the what if in a heartbeat.
If you all who are watching, and I know we're winding down the hour here, but if you all have suggestions for other topics that we could present during a virtual town hall in the weeks ahead, I hope you'll share those ideas with us. You can do so by emailing info@andrewromanoff.com, info@andrewromanoff.com. We sent our staff home like everybody else, so we're conducting our campaign online, but we want to keep this conversation going. We give one last minute. I know we didn't address all the questions that came in, but for any of the panelists, is there a topic that you were burning to share and we didn't get to address in the course of this town hall meeting?
If I can start, I'd just like to, kind of wrapping up. Depression and anxiety are going to be increasing and experienced by many. And in my work, with addiction, I just want everybody to be mindful that many people that suffer from addiction and abuse substances, they're undiagnosed or they're self-medicating to treat depression and anxiety. So thinking that the answer to this situation lies in drugs or alcohol, I'm just urging and asking everyone not to go that route.
Thank you all very much for sharing your time. I know there's a number of suggestions that are coming in, particularly around the economic impact of this crisis, so that will likely be the topic of our next virtual town hall. We'll post contact information, if they're willing, for the folks who are joining us on this panel, along with a recording of this conversation. I want to say thanks to our panelists and thanks to everybody who has joined us through Facebook or Zoom or by phone. We're going to get through this crisis and we're going to do it together. Thank you all. Stay healthy, stay safe.
Thank you.
Thanks.